Thank you, Allison, and thank you everyone for joining us for pre-licensing for the 2025 Wisconsin Health Insurance Enrollment Conference. We are so happy that you could join us, and I look forward to spending the next 16 hours with you the next week or so. Today, we'll have presentations from the Wisconsin Department of Health Services and then from the Office of the Commissioner of Insurance. So our first session will be learning about applying for Wisconsin's healthcare programs with DHS. Excuse me. And then we will have a short 10-minute break and then resume our presentations with OCI. So to begin, Nikki is a policy analyst and currently works in the enrollment and outreach section, focusing on elderly, blind, and disabled and long-term care consumers. Prior to joining the enrollment and outreach section, she worked in the income maintenance training section, focused primarily on tracking EBD and LTC Medicaid to new income maintenance workers. She has worked at DHS since 2015, and prior to joining DHS, Nikki worked for Iowa County for 17 years, 11 of which she was an economic support specialist working with families, elderly, blind, and disabled, and long-term care customers. We also have Masiel, who is an enrollment and outreach coordinator, and she works directly with community partner organizations who assist clients in enrolling and maintaining public benefits. Her role is to provide partner updates, communications, and policy clarification, troubleshoot benefit or case issues, and collect stakeholder feedback to report trends to DHS leadership on policy processes and issues. With her 21 years of experience with Wisconsin Medicaid, Masiel has used her skill and familiarity with eligibility requirements to advocate for recipients both for English and Spanish-speaking populations, identify systemic barriers, and collaborate with health providers, partner organizations, and the department to make needed improvements for Medicaid recipients. Masiel continues to be an active part of the community by attending several coalitions where she lends a keen partner recipient perspective and develops strong partner relationships essential to the continued efforts in providing optimal service for Wisconsin state residents. I will go ahead and hand it over to Nikki and Masiel for applying for Wisconsin's healthcare programs.
Thank you, Elizabeth. I'm going to go ahead and share my screen. And if you all could let me know.
Looks
Make
good.
sure you're great. All right. Good morning, everybody. Welcome to Applying for Wisconsin's Healthcare Programs. I'm so happy to be here with you all today. Just to start us off, questions can be entered in the Q&A box, and we will address any questions at the end of the session as long as we have time, and we should. As Elizabeth mentioned when introducing me, I've worked with Wisconsin's healthcare programs in one capacity or another for close to 25 years, but readily admit I don't have all the answers. So Masiel is thankfully here with me to assist with your questions. And if there are any we can't answer between us or don't have time for, we'll be sure to get answers to Elizabeth so she can follow up with you all later. So let's go ahead and get started. Today's agenda includes the purpose of this training, program basics, how to apply for Wisconsin's healthcare programs, what to expect after applying, outcomes, and finally, resources. Let's start with the purpose of this training, which is to provide navigators, certified application counselors or CACs, partners, agents, and brokers with a basic understanding about how to apply for Wisconsin's healthcare coverage programs and what to expect throughout the application process. Let's move on to program basics. Badger Care Plus covers children ages 0 through 18, parents and caretaker relatives of children ages 0 through 18, pregnant people, and childless adults ages 19 through 64 who are not receiving Medicare except for Medicare Part B immunosuppressive drug benefit, also known as Medicare Part BID. More details on Badger Care Plus will be given in the Badger Care Plus eligibility rules session when we meet again on Friday. Medicaid for the elderly, blind, or disabled also known as EBD Medicaid, covers adults age 65 and older, individuals who are blind, and individuals who are disabled. And again, more details on EBD Medicaid will be given in the EBD Medicaid eligibility rules session. Most of Wisconsin's healthcare programs are administered by a network of county and tribal income maintenance, or IM, agencies. IM agencies process applications, make eligibility decisions, and issue benefits. All IM agencies use the CARES Worker Web eligibility system, also known as CWW, to administer benefits. All program rules are the same statewide, and applications are assigned based on where the applicant lives. Most county IM agencies are organized into 10 regional consortia. Excuse me, and you can find information on those consortia at the link shown on this slide. Milwaukee County IM is administered by the Wisconsin Department of Health Services, or DHS, through Milwaukee Enrollment Services, also known as MILES. And Menominee County IM is administered by the Menominee Indian Tribe of Wisconsin. When someone applies for healthcare coverage, the IM agency considers whether the person meets all the non-financial rules for healthcare programs. For example, is the person a US citizen, or does the person have a qualifying immigration status? And whether the person meets all the financial rules for healthcare programs. For example, does a 67-year-old applicant have assets below the EBD Medicaid asset limit? And then, based on the individual's situation, which specific healthcare category is the most appropriate? For example, does the person qualify for Badger Care Plus or for a type of EBD Medicaid? When someone applies for full benefit health coverage in Wisconsin, they do not have to specify which program they're applying for. The CWW eligibility system will determine the best possible coverage for the applicant based on the program rules and the applicant's information. If someone is not eligible for Badger Care Plus or EBD Medicaid, but might be eligible to enroll in a qualified health plan or QHP at the marketplace, their application will be transferred automatically to the marketplace. Now that we've gone over some of the program basics, let's take a look at applying for Wisconsin's healthcare programs. In addition to healthcare, people can also apply for other programs in Access, including food share, family planning only services, caretaker supplement as part of a healthcare or food share application, Wisconsin Shares Child Care Subsidy, Wisconsin Works, also known as W-2, Job Access Loans, also known as JALs, and emergency assistance. People can also start a request for assistance for the Women, Infants, and Children, also known as WIC, program. A person may use any of the methods shown on this slide to complete and submit an application, including applying online at access.wi.gov, applying in person or face-to-face, applying via phone, or applying by submitting a paper application. The filing date is the day a signed healthcare application is submitted to the IM agency. In most cases, healthcare eligibility starts as of the first day of the month in which the application was filed, if the individual is eligible. Applicants can also request up to 3 months of backdating for most healthcare programs. Although please note that some pregnant people who are immigrants or incarcerated in a correctional facility, such as a jail or prison, as well as children with higher incomes, do not qualify for backdated coverage. IM agencies have 30 days from when they receive the application to determine eligibility. Everyone applying for or receiving Badger Care Plus or Medicaid has the right to be treated with respect by IM agency staff, have their civil rights upheld, have their private information kept private, get an application or have the application mailed on the same day it's asked for, file an application right away, even if they're not in the correct office, and get a decision about their application within 30 days of the day the agency receives it. Everyone applying for or receiving Badger Care Plus or Medicaid is responsible for providing accurate information, providing proof of information when requested, and reporting changes as required by the program of assistance they're eligible for. For a full list and more information on rights and responsibilities, you can see the Enrollment and Benefits Handbook, which is available at the link shown on this slide. All right, that brings us to our first poll question. Question 1, which is not an allowable way to submit an application? A, completing an application by phone with an income maintenance worker. B, mailing in a paper application. C, completing an application online at access.wi.gov. D, completing an application through online chat with an income maintenance worker. Or E, meeting face to face with an income maintenance worker to answer the application questions, which is not an allowable way to submit an application. I'll give you some time to answer that. And Elizabeth, as soon as you see that a majority of people have answered, you can go ahead and bring up the results.
We have just about 76% of people who have answered so far, so I'll give it just another couple seconds and then close that out.
Thanks, Mike.
Of course.
All right, great job. A majority of you did pick the correct answer. The correct answer is D. Unfortunately, Access does not have an online chat feature for people to communicate directly with an income maintenance worker. Applicants and members with questions can call their income maintenance agency or member services. Great job. All right, let's talk about the different methods of applying for healthcare. We'll start with Access, which allows members to apply for and manage their state of Wisconsin benefits and programs in one place at any time. The Access website is, as shown on this slide, access.wi.gov. Access connects members to the help they need when they need it. One of the Access functions, titled See If You Can Get Help, is a short screening tool to find out which benefits you might be able to get. No Access login is needed for this tool. Another Access function is Apply for Benefits, which allows applicants to apply online for healthcare coverage, including Badger Care Plus and EBD Medicaid, family planning only services, food share, caretaker supplement as part of a healthcare or food share application, Wisconsin Shares Childcare Subsidy, Wisconsin Works or W-2, emergency assistance, also known as EA, which is different than emergency services for healthcare, and job access loans, also known as JALs. Applicants can also complete a pre-application for Women, Infants, and Children program, also known as WIC. This takes them outside of the Apply for Benefits module, and their pre-application information is sent to the WIC clinic in their area. In some cases, applicants may be able to get an immediate eligibility decision for healthcare. When they do, that's called real-time eligibility. An Access account also allows members to check benefits, renew their benefits, pay premiums, manage their HMO, report changes, view their electronic notices, and perform other benefit management functions. To perform these benefit management functions, members need to create, authenticate, and use an Access account. As a note, members can also check their benefits and do some benefit management functions on the My Access mobile app. More information will be given about My Access later in this presentation. All Access pages are available in Spanish by clicking the Espanol link, and users are able to view help text for questions that may need additional explanation. The Access training site can be used to teach people how to use Access. This site cannot be used to apply for benefits. You can access the training site at the web address shown on this slide. Walk-in and telephone applications are also ways in which applicants can apply for healthcare. Individuals have the option to apply in person at their county or tribal IM agency. They may also apply by phone. Each consortium has a central phone number for taking applications and other customer services. You can find phone numbers and office locations at the link shown on this slide. And the last method of applying for healthcare is a mail-in application. Because they have different eligibility rules, Badger Care Plus and EBD Medicaid have different application forms. The Badger Care Plus mail-in application, Form F10182, is available at the first link shown on this slide. And EBD Medicaid mail-in application, Form F10101, is available at the second link shown on this slide. However, either application can be used to make a request for full benefit health coverage. And that brings us to our next poll question. Question 2. Which of the following actions can a person not do in Access? A, request a fair hearing to appeal a denial of benefits. B, check their existing benefit enrollment status. C, view electronic notices about their benefits. Or D, report changes to their household situation. Which of those actions can a person not do in Access?
And we're sitting at about a 75% who have answered, so we'll give that just another few seconds and then go ahead and close that out.
Sounds good. Thank you. Wonderful. Great job, everybody. So the correct answer is A. If an applicant or member wants to request a fair hearing in order to appeal a negative action taken on their application or case, they must submit their request to the Division of Hearings and Appeals. And we're going to have more information on fair hearings later in the presentation. All right, that brings us to what to expect after filing an application. Let's start with some information about who will be processing submitted applications. Applications submitted via Access may include programs that are not processed by income maintenance agency workers. Income maintenance agency workers process applications for healthcare, food share, caretaker supplement, and Wisconsin Shares childcare subsidy. State staff process applications for Katie Beckett Medicaid. Programs processed by other agencies include Wisconsin Works or W2, Emergency Assistance or EA, Job Access Loans or JALs, and Women, Infants, and Children Program or WIC. Information in our presentation this morning is specific to healthcare programs processed by income maintenance agency workers. Before making a decision about eligibility, IM agencies must verify the information the applicant has reported. In many cases, IM agencies can use data exchanges to verify the following information: citizenship, immigration status, earnings from a job, Wisconsin unemployment benefits, Social Security, supplemental security income, also known as SSI income, child support payments, and some liquid assets. In other cases, applicants will be asked to submit proof of what they've reported. Proof can be submitted by fax, mail, in person, or through Access or My Access. We encourage people to use Access and My Access if they can, because doing so submits the document to IM right away. And My Access allows people to use their cell phone to take a picture of a paper document and submit it, so no scanner is needed. Or postage if they're mailing it in. The agency will send a verification checklist, also known as a VCL, titled Required Next Steps to Receive Your Benefits, listing the items that are needed and the date they're due by. A VCL will also be sent if the agency is missing information needed to make a decision and will include the date by which the agency needs the information. If an applicant does not provide the requested verification or information by the due date listed on the VCL, the application will be denied. So let's talk more about that verification checklist, also known as the VCL. It lists verification requirements for Badger Care Plus or Medicaid, as well as caretaker supplement and food share if applicable. It provides the due dates for providing the information requested. It contains specific examples of documents that are needed. And it includes a document tracking sheet, which can be used to submit documents if they're scanning them. And if they're using their phone, they can take a picture of that document tracking sheet first. The VCL, again titled Required Next Steps to Receive Your Benefits, informs the applicant or member that to get or keep benefits, they should read the entire document for details on programs, people affected, and deadlines. They should be sure to complete all tasks by their due dates and refer to the send in documents at the end of the letter for instructions. The first page of the VCL includes a summary of all required due dates and tasks to complete. Examples of tasks to complete could include actions to complete, questions to be answered, listed as answer questions, and proof documents to be sent in, listed as send in proof documents. As you can see on this VCL, the only task this member is required to complete is to send in proof documents. Agency contact information is found after the summary of all required due dates and tasks and before the first task section. Each task type listed in the summary will have its own section following the agency contact information. Here you can see the beginning of the only section for this example, the Send in Proof Documents section. The Send in Proof Documents section continues on page 2, listing the proof needed, who the proof is needed for, which program or programs require this proof, and the due date of the proof needed. Additionally, examples of ways to give proof are included, as well as where to look and what to do if you need additional assistance. Finally, the Send in Documents section is printed at the end of the VCL, providing instructions for submitting documents, including how they can be submitted and where they can be submitted to. The case head's name will be pre-printed on this page with the opportunity for them to enter their phone number and the total number of pages being sent, including the cover sheet, as shown in the red box on the slide. Now let's talk about possible outcomes of the application. After the IM agency has verified the information reported on the application, the agency will make a decision about eligibility. The applicant will receive a letter telling them if their benefits are approved or denied. This is called a notice of decision, also known as an NOD, and is titled About Your Benefits. The notice of decision begins with a summary table that includes 3 columns. The program column indicates the specific program being applied for. In this example, you can see the program is healthcare. The status column indicates the status of the program listed in the first column. In this example, the application for healthcare was approved for everyone who applied. And the details column indicates the eligibility details of the household. In this example, you can see that the application was submitted on April 11th, and they need to see the Your Healthcare Benefits section to learn more. The Who is enrolled in healthcare benefits table lists when this information is effective, who has eligibility, the plan or program they're finding eligibility under, and whether there is a monthly premium. In this example, you can see that the effective date is April 1st, that both the parent and the child are eligible for Badger Care Plus with no monthly premium, and that they'll continue to receive the healthcare benefits shown until there's a change in their case. If there was a change in their case, they would receive another notice of decision letting them know what that change was. And obviously, on a real notice of decision, it will have the parent's name and the child's name in the who column. Some other sections of the notice of decision are a copay limit information section that lists everyone's copay amount if they have one, a who has a monthly cost or premium section if they have a monthly cost or premium associated with their eligibility, a financial details section listing the income and bills we have on file for the household, a section about how we counted their income that provides the amounts and limits that were used to decide their eligibility, a reporting rules section telling members what changes need to be reported to the local agency and when. And as a note, it's important for members to understand they must contact their IM agency or report changes in access. Changes reported to member services, which is the phone number on the back of the Forward Health card, or to the HMO are not shared with the IM agency. If they have changes, they need to report it to their IM agency or do it through access. Additionally, key contacts are listed. This section provides information about who members should contact with questions, and fair hearing information is given. The last page of the notice provides information about fair hearings, including the date by which a hearing must be requested and how to ask for a hearing. So, if benefits are denied, reduced, or ended, and the applicant or member believes the IM agency made a mistake, they can contact the IM agency directly to discuss the situation and try to find a resolution. If the applicant or member would like to request a fair hearing, they can ask the agency for help in requesting a fair hearing, or they can also directly contact the Division of Hearings and Appeals to request a fair hearing. At the hearing, a hearing officer will hear from the applicant or member and the agency to find out if the decision was right or wrong and require the agency to take action as appropriate. After the hearing officer will send a written decision to the individual and the agency. And that brings us to our next poll question. Question 3, what is not included with the notice of decision? A, a list of who in the household is enrolled in benefits. B, the reporting rules stating what types of information the household must report to the income maintenance agency within a certain time period. C, information about how to request a fair hearing. D, a list of the income and deductions used to determine eligibility. Or E, permanent forward health cards for members eligible for Badger Care Plus or Medicaid. Which of these is not included with the notice of decision?
We'll give that just another couple seconds and close that poll out.
All right, great job. The correct answer is E. Permanent plastic forward health cards are not included with the notice of decision. If a person is a new member, their forward health card will be mailed to them separately. New forward health cards will not be mailed to people who were previously enrolled in Badger Care Plus or Medicaid. These members can use their old card if they still have it, so it's important to let members know that they shouldn't throw away their forward health card if they lose eligibility. Rather, they should keep it in a safe place in case they regain eligibility anytime in the future. We're going to talk about how they can get a new card if needed in just a bit. But I do just want to note that individuals eligible for real-time eligibility, which we talked about briefly earlier, right? That's when someone meets the criteria for an immediate eligibility decision for healthcare through access. And members eligible for presumptive eligibility, which we'll be discussing more in the eligibility for Badger Care Plus session. Those people may get their notice of decision and a temporary paper forward healthcare card online at the same time, but we don't provide permanent forward health cards with the notice of decision. those come separately. All right, let's talk about receiving services. Each eligible person will receive a Forward Health Card if they haven't received one in the past, which should be shared with providers when services are requested. If someone has received a Forward Health Card in the past, they will not get a new one, as we talked about on the last slide. So you should be encouraging members to keep their card in a safe place, even if they're no longer eligible for health care. Members can request a new card by either calling Member Services at 1-800-362-3002 or requesting one through their authenticated access account. Covered services are listed in the Enrollment and Benefits Handbook, which can be accessed at the link shown on this slide. Some services may require prior authorization. The provider will request authorization on the member's behalf. For some services, members may be required to pay a copayment or a copay, also known as. However, monthly premiums and copays for Badger Care Plus or Medicaid card services must not be more than 5% of their household income. The 5% cost share limit applies to members eligible for Badger Care Plus, SSI Medicaid, and most EBD Medicaid programs. However, members enrolled in MAP and senior care do not have a cost sharing limit. This limit does not apply to deductibles, patient liability amounts for institutional Medicaid, or cost sharing amounts for home and community-based waiver services. For members subject to the cost sharing limit, a copay limit will be set on a monthly basis. The copay limit is based on the assistance group's income used to determine eligibility. Copays are tracked based on copays the individual has incurred, not the amount of copay that the member has actually paid out of pocket, since they may have incurred more than they've actually paid. For example, the provider may allow them to charge a copay amount. Most copays range from 50 cents to $3. Providers may make a reasonable effort to collect the copay, but they may not refuse services if the member does not pay. For questions about covered services and for help with finding a Badger Care Plus or Medicaid provider, individuals can contact Member Services at 1-800-362-3002. Now let's talk about renewals. Eligibility must be renewed every year. For some individuals, eligibility can be renewed through what's called an administrative renewal. An administrative renewal occurs when the IM agency is able to verify all information for an individual through data exchanges. When an administrative renewal occurs, the member does not need to take any action to complete the renewal for those individuals. If at least one member on a case is successfully administratively renewed, a letter will be sent listing the members who are administratively renewed and a summary of the information that we use to complete the administrative renewal. While action by the member was not required to complete the administrative renewal, members are required to review the summary and report any changes to the agency within 30 days. If there are members not able to be administratively renewed, they will receive a letter with instructions for completing the renewal approximately 45 days prior to the end of their 12-month certification period. The renewal process for those not able to be administratively renewed can be completed online, by phone, in person, or by mail. We encourage members to submit their renewal as soon as they can after receiving the letter with the renewal instructions. Members who submit their renewal before or on the last day of the renewal month will have their coverage maintained until the IM agency finishes processing the renewal. And that brings us to our last poll question. Question 4, which of the following is false? Members will receive a letter with instructions for completing a renewal. Members always need to submit a renewal form to their income maintenance agency as part of completing their renewal. Or C, the renewal process can be completed by phone, by mail, in person, or online. Which of the following is false?
We'll give that poll question just another 10 seconds here and then close that out.
Great job. B is the false statement. If income maintenance agencies are able to renew eligibility administratively for all members on the case, a renewal form would not be required to be submitted. They would just be required to review the summary sent to them and report any changes. That brings us to our additional resources. Members with an authenticated Access account can download the My Access mobile app to do the following. They can check their benefits to see the programs the members enrolled in, including HMO contact information and when their next renewal is due. Members that have been issued a Forward Health or Senior Care card can also view those digital cards in Access or My Access. They can get reminders of actions the member needs to take or the documents the member needs to submit. They can take photos of and submit proof at any time, then check its status in real time. They can update their home address, mailing address, and phone numbers. The My Access mobile app can be downloaded for free at the App Store or Google Play. Another resource for members is a guide to applying, which is available at the link shown on this slide and includes information about who can enroll, how to apply, required verification, benefits and services available, rights and program rules, and fair hearings. The Enrollment and Benefits Handbook, available at the link shown on this slide, is sent to all applicants and members and includes information about benefits and services available, program rules, required verification, change reporting requirements, covered services and prior authorizations, rights and program rules, and fair hearings. You can find information about IM agencies which determine eligibility for Badger Care Plus and Medicaid at the first link shown on this slide. And you can find information about aging and disability resource centers, which, among many other things, provides enrollment counseling for home and community-based waiver programs at the second link shown on this slide. We'll talk about more about home and community-based waiver programs on Friday. Member services, whose staff can answer general member questions, information about covered services, and help with finding a local IM agency, can be contacted by calling 1-800-362-3788 3002. And this is the same number that's on the back of the Forward Health card. And as we talked about earlier, a fair hearing can be requested through the Division of Hearings and Appeals. Their telephone number is 608-266-7709. And more information about the Division of Hearings and Appeals can be found at the link shown on this slide. Some resources for partners include information about Wisconsin's healthcare programs, including member fact sheets, which can be found at the first link shown on this slide. And partner demonstration videos can be accessed on the Wisconsin Medicaid and Food Share Partner Resources for Eligibility and Enrollment Vimeo site at the second link shown on this slide. There are a lot of great partner demonstration videos on that second link shown on this slide. And that does complete our Applying for Wisconsin Healthcare Programs presentation. So we do have time for questions. Let's go ahead and take a look at those questions. Looks like there's only one that wasn't answered. I've run into the scenario. Patient applies online, check they want to receive notices online. Patient receives text email noting additional documentation is required. Patient logs in online and are required to verify identity with the last bullet requiring a case number or forward ID, which they don't know. They only have an application tracking number. Is there any way around this without calling? So maybe Masiel can help me out with this, but I think that once the application is submitted through Access,
I've been
they get the application tracking number.
right.
And it's not until the application is processed that there's actually a case number.
Right. I'm actually working on the back end here, trying to reach out to my access gurus to get a response to that. So Naomi, we may need to bring this one back just to get the correct answer.
My instinct is to say there isn't any way around that, because I don't think that once the application is processed by the IM agency, then the verification request would also list the information that's needed. And if they log into Access to get and are able to see that verification request, that official VCL or verification checklist will have a case number on it. But it wouldn't be until after the agency processed it, because there's no case number until the agency processes it, unless they've had a case in the past and they were the primary person on that case. All right. When applying for medical assistance, may the applicant apply for Delta Dental? And if so, how is the monthly premium determined? Delta Dental is not a Medicaid program. So to my knowledge, they can't apply for that on Access, correct, Masiel?
Yes, Delta Dental, to my knowledge, is a commercial insurance. It's not Medicaid. However, I am not in the benefits world. I'm in the enrollment and eligibility world. So, Lynette, if you still continue to have questions, feel free to go ahead and email that email address that's on the screen, and we'll get back to you.
Yeah, I know that there is no in Access, you can't apply for Delta Dental.
Right.
I know that for a fact. All right. Would that be the same with a PIN? Do we always need to call and get that number if patient does not have a SSN? The PIN is not created until the case is processed, but they may have a PIN. If they were ever on a case before, they may have a PIN number.
Right. It is possible that I've seen instances where an individual was on a parent's case and or whatever and had a PIN. Um, doesn't it doesn't always carry over. It depends. So to the answer to your question, anonymous, would be it depends.
Will you be able to email all of us back on some of these answers since we might not have these questions currently, but may in the future?
The process for this will be Nikki and I are working closely with Elizabeth to gather the questions that are being asked. We will bring those back to the department to get the proper answers. And then Elizabeth will go ahead and publish those answers for folks who are not only on this call today, but may be listening to the webinar afterwards.
And that will only be for questions that aren't answered live
Exactly.
during the
Exactly.
session. Any other questions? All right. Well, if there are no other questions, I think that does end our time together today. I will be back on Friday with you. You might get sick of me on Friday because you have me for both sessions. We've got Badger Care Plus and then also EBD Medicaid on Friday. Thank you. Thank you, everybody.